Bedtime fixes that drain foot swelling overnight, senior health tips. This comprehensive guide, presented by Dr. Claire Whitmore, a cardiac surgeon with 2 decades of experience, offers a revolutionary approach to tackling swollen feet and ankles, a common and often overlooked issue, particularly among seniors. Dr. Whitmore emphasizes that what might seem like mere discomfort could actually be a critical warning sign indicating underlying health problems. She stresses that the distinction between a potentially dangerous approach and a life-saving one lies in accurately diagnosing the cause of the swelling and implementing the correct treatment. This video promises to equip viewers with actionable knowledge that is invaluable, going far beyond the scope of typical medical consultations. It aims to provide a complete diagnostic framework to pinpoint the specific type of edema, detail precise overnight remedies tailored to each cause, reveal common medications that contribute to swelling that may have gone unnoticed by patients and their doctors, and highlight crucial warning signs that necessitate immediate emergency medical attention. The information provided is designed to be immediately implementable, and viewers are cautioned that missing even a single detail could mean the difference between resolving the issue effectively and requiring urgent medical intervention. The video meticulously breaks down swelling into 5 distinct categories, as the appropriate treatment is entirely dependent on the origin of the fluid retention. Type 1, known as dependent edema, is the most prevalent among seniors and is primarily caused by gravity, exacerbated by prolonged periods of sitting or standing. Fluid accumulates in the lower extremities simply because gravity pulls it downwards, and the circulatory system struggles to return it efficiently. Individuals experiencing this type of swelling will notice it worsening as the day progresses, a marked improvement in the morning after a night of rest, and an equal distribution of swelling in both feet. Type 2, venous insufficiency, arises from compromised valves within the leg veins. These valves are crucial for preventing blood from flowing backward, and when they weaken or become damaged, blood pools in the lower legs, leading to swelling, aching, and often visible varicose veins or changes in skin coloration. This swelling is frequently more pronounced in one leg than the other, and is accompanied by a sensation of heaviness or fatigue. While elevation can offer some relief, it is not a standalone solution. Compression and specific exercises are vital. Type 3, lymphedema, stems from a compromised lymphatic system. The lymphatic vessels are responsible for draining excess fluid from tissues, and when they are overwhelmed or damaged, protein-rich fluid accumulates. Lymphedema presents with a distinct feeling of tightness and thickness in the skin, and indentations made by pressure tend to remain for a considerable time. This type of swelling often begins in the feet and gradually ascends the legs, and individuals with a history of lymph node removal, radiation therapy, or severe infections are at a higher risk. Type 4, medication-induced edema, is a consequence of numerous common medications that cause fluid retention as a side effect. Among the most notorious are calcium channel blockers, like amlodipine, used to manage blood pressure. Non-steroidal anti-inflammatory drugs, NSAIDs, steroids, certain diabetes medications, and hormone replacement therapy can also contribute. If swelling began or significantly worsened shortly after starting a new medication, this is a strong indicator. The solution here is not physical measures, but a conversation with a doctor about alternative prescriptions. Finally, type 5, cardiac or renal edema, is the most serious and is indicative of heart failure or kidney disease. When the heart's pumping function is impaired or the kidneys are unable to filter fluid effectively, the body retains excessive amounts of fluid. This type of swelling typically affects both legs uniformly, extending beyond the ankles to the calves or even thighs, and is accompanied by other alarming symptoms such as shortness of breath, fatigue, or a noticeable decrease in urine output. This necessitates immediate medical intervention, far beyond simple bedtime remedies. To empower viewers to identify their specific type of swelling, Dr. Whitmore introduces a simple yet effective diagnostic test. By pressing a thumb firmly into the front of the shin over the bone for 10 seconds and observing the indentation upon release, one can determine the presence of pitting edema. If the dent remains visible for over 10 seconds, it indicates pitting edema, thus ruling out lymphedema, which is non-pitting. Next, comparing the swelling in both legs is crucial. Equal swelling on both sides suggests dependent edema, medication-induced edema, or cardiac renal edema. If one leg is significantly more swollen, it points towards venous insufficiency, or more critically, a potential blood clot, which demands immediate medical attention. The timing of the swelling provides further clues. Swelling that worsens throughout the day and improves overnight is characteristic of dependent edema or venous insufficiency. Conversely, swelling that remains constant or worsens overnight raises concerns for cardiac or renal issues. The presence of additional symptoms, such as shortness of breath when lying flat, waking up gasping for air, or profound fatigue, are strong indicators of heart failure. Similarly, a decrease in urination, foamy urine, or swelling around the eyes, in conjunction with leg swelling, are red flags for kidney disease. Dr. Whitmore reiterates the critical importance of recognizing emergency warning signs. Sudden, severe swelling in a single leg, especially if accompanied by pain, redness, or warmth, could signify a blood clot, a potentially fatal condition requiring immediate emergency room assessment without delay. Likewise, leg swelling coupled with chest pain, severe shortness of breath, or an overwhelming sensation of air hunger warrants an immediate call to 911, as these symptoms could indicate a life-threatening heart attack or pulmonary embolism. For individuals experiencing chronic, gradual swelling in both legs without these acute warning signs, Dr. Whitmore then details a comprehensive 5-element bedtime protocol designed to effectively drain excess fluid overnight. This multifaceted protocol is engineered to work synergistically, addressing the root causes of edema from various angles. The first crucial element is strategic elevation. Simply propping feet on a pillow is often insufficient. The correct technique involves elevating the feet to a level at least 12 inches higher than the heart, utilizing a foam wedge or multiple firm pillows to support the entire leg from ankle to upper thigh. The recommended angle is between 20 and 30 degrees, ensuring optimal gravitational fluid drainage back towards the core, while maintaining a slight bend in the knees to avoid constricting blood vessels. This elevated position must be sustained throughout the entire night, as intermittent elevation significantly diminishes its efficacy. Physiologically, proper elevation leverages gravity to reverse the day's fluid accumulation, channeling it back into the venous circulation for filtration by the kidneys and subsequent elimination through urination. Experiencing increased nighttime urination is not a problem, but a sign that the protocol is actively working to expel trapped fluid. Element 2 involves compression therapy, but with a critical distinction. It is to be worn during the day, not at night. Compression stockings are designed to prevent fluid from accumulating in the first place and are removed before sleep to allow for maximum overnight drainage. Dr. Whitmore stresses the importance of selecting graduated compression stockings, which are tighter at the ankle and gradually loosen upwards, creating a pressure gradient that aids venous return against gravity. The compression level is measured in millimeters of mercury, mmHg. 15 to 20 mmHg is recommended for mild to moderate swelling, while 20 to 30 mmHg is advised for more severe cases or diagnosed venous insufficiency, often requiring a prescription. Proper fitting is paramount. Stockings that are too loose are ineffective, and those that are too tight can impede circulation. Accurate measurements of ankle circumference, calf circumference at its widest point, and leg length are essential for selecting the correct size. Knee-high stockings are generally preferred for comfort and practicality, as thigh-high versions can roll down. Compression stockings should be put on first thing in the morning, before standing, while the legs are still in a relaxed, unswollen state. Keeping a pair bedside and donning them immediately upon waking, before feet touch the floor, is crucial timing. They should be worn continuously throughout the day and removed only at night. Regular washing is necessary to maintain their elasticity and effectiveness, and replacement every 3 to 6 months is advised, as they are a worthwhile investment for managing venous edema and preventing complications like skin ulcers and infections. Element 3 introduces lymphatic drainage massage, a gentle, 5-minute self-massage performed nightly before bed. This technique manually encourages the movement of fluid from the tissues into the lymphatic vessels for drainage. The key is light, sweeping strokes directed towards the groin, where major lymph nodes are located. The process begins with slow, gentle strokes from mid-thigh towards the groin, followed by strokes from the knee upwards towards the thigh, then from the ankle upwards towards the knee, and finally, using thumbs, from the toes towards the ankle on both the top and bottom of the foot. The pressure should be minimal, just enough to move the skin, as lymphatic vessels are superficial and respond to light touch. This sequence is repeated 3 times, taking approximately 5 minutes, and primes the lymphatic system for efficient drainage during sleep. Element 4 focuses on strategic hydration, which might seem counterintuitive when dealing with excess fluid. However, dehydration triggers the body's fluid conservation mechanism, leading to increased fluid retention and worsened swelling. Proper hydration ensures that the kidneys function optimally, allowing them to filter and eliminate excess fluid. The strategy involves front-loading water intake throughout the day, consuming the majority of fluids between waking and 5 p.m., with a significant reduction in intake prep thereafter. This ensures the body is adequately hydrated without overwhelming the system before sleep. Crucially, dramatic reduction in sodium intake is also emphasized. Sodium causes the body to retain water, and most seniors consume far more than the recommended limit. Eliminating processed foods, restaurant meals, and excessively salty items, and cooking from scratch with fresh ingredients, using herbs and spices for flavor, can lead to significant improvements in swelling within 2 weeks. The 5th element comprises specific supplements that naturally reduce fluid retention. Magnesium glycinate, 400 milligrams taken before bed, helps regulate fluid balance and improve circulation, with this form being well absorbed and less likely to cause digestive upset. Potassium plays a vital role in fluid balance alongside sodium. However, obtaining sufficient potassium solely through supplements can be risky. The recommendation is to increase consumption of potassium-rich foods like bananas, potatoes with skin, and spinach throughout the day. For venous insufficiency and edema, horse chestnut seed extract is highlighted as a potent natural remedy. Studies show it effectively reduces leg swelling and discomfort, comparable to compression stockings. A standardized extract of 300 milligrams twice daily, taken with food, is recommended. Dr. Whitmore then addresses a critical aspect often overlooked: medications that can induce foot swelling. Common culprits include calcium channel blockers like amlodipine, NSAIDs, steroids, certain diabetes medications, and hormone replacement therapy. If swelling began or worsened after starting a new medication, it is imperative to discuss this with a healthcare provider to explore alternative prescriptions. ACE inhibitors or ARBs are often viable alternatives for blood pressure management, while acetaminophen or topical pain creams can be considered for pain relief instead of NSAIDs. For steroid-induced swelling, a dose reduction, if medically permissible, can be beneficial. Patients on diabetes medications like thiazolidine-diones should consult their doctor about switching to non-fluid retaining alternatives. A thorough review of all medications with a doctor or pharmacist is strongly advised. The video culminates by outlining a precise nightly routine that integrates all 5 elements of the protocol. This includes low-sodium dinner at 6 p.m., cessation of fluid intake by 8 p.m., except for medications, the 5-minute lymphatic drainage massage at 9 p.m., and magnesium intake at 9:15 p.m. By 9:30 p.m., viewers should be in bed, with legs properly elevated on a wedge or pillows to a height of 12 inches above heart level at a 20 to 30 degree angle, ensuring knees are slightly bent. Maintaining this elevated position throughout the night is paramount, and comfortable sleeping positions on the back or side are acceptable as long as elevation is preserved. The increased nighttime urination experienced is a positive indicator of the protocol's efficacy. The following morning, before standing, compression stockings should be applied. Consistent adherence to this protocol for at least 2 weeks is crucial for evaluating results, with noticeable improvements often seen within days and significant benefits within weeks. Addressing advanced situations, Dr. Whitmore acknowledges potential difficulties with sleeping in an elevated position, advising gradual acclimatization and ensuring adequate support. For those with arthritis or back pain, experimenting with side-lying positions or lumbar support is suggested. with a recommendation to focus more heavily on daytime compression, massage, and supplements if elevation is truly intolerable. For individuals already on diuretic medication, the protocol is presented as complementary, enhancing the diuretic's effectiveness. Importantly, for those with heart failure or kidney disease, the protocol serves as an adjunct to medical treatment, not a replacement, and immediate medical consultation is advised if swelling or shortness of breath worsens significantly. Real-life patient outcomes are then shared, illustrating the protocol's effectiveness in resolving medication-induced swelling, improving chronic venous insufficiency, and managing edema associated with mild heart failure, underscoring the tangible improvements in comfort, mobility, and overall quality of life. Whitmore dispels common misconceptions about diuretics and dehydration, clarifying that the protocol facilitates the elimination of excess fluid, not dehydration, and emphasizes the vital role of adequate hydration. She debunks the myth of sweating out swelling through excessive exercise or saunas, highlighting that such practices can be dangerous due to dehydration and electrolyte imbalance. The video concludes with a critical list of warning signs necessitating immediate medical evaluation, including sudden severe unilateral leg swelling with pain and redness, potential blood clot, rapid onset bilateral leg swelling with shortness of breath, acute heart or kidney failure, developing skin breaks or signs of infection on swollen legs, cellulitis, and swelling accompanied by abdominal swelling, jaundice, or confusion, liver failure. She also notes that severe, non-pitting woody swelling may indicate advanced lymphedema requiring specialist care. The paramount importance of differentiating between treatable chronic edema and urgent medical emergencies is underscored. Furthermore, Dr. Whitmore highlights the significant, often unaddressed, increased risk of falls among individuals with swollen feet due to impaired gait, reduced sensation, and ill-fitting footwear. She strongly advises taking precautions to prevent falls, such as using handrails and wearing appropriate footwear. Finally, a comprehensive action checklist is provided for immediate implementation, covering diagnosis, ruling out emergencies, medication review, acquiring necessary equipment and supplements, dietary adjustments, and nightly routine execution. The video also introduces a membership community for individuals requiring personalized guidance for complex cases, offering live Q&A sessions and in-depth supplemental content. Dr. Whitmore reiterates that addressing foot swelling is not merely cosmetic, but fundamental to maintaining mobility, preventing falls, and identifying potentially serious underlying health conditions. She encourages viewers to be consistent, patient, and to listen to their bodies. The video ends with a call to action. Subscribe to the channel for more in-depth health information, share the video with those in need, and leave comments with personal experiences and questions. The message is clear. Attentive care for one's feet is crucial, and this protocol offers a scientifically backed path to achieving comfortable, healthy legs once more.